in 1980, Michele Pease Downey's dream was to qualify for the U.S. Olympic swimming team. At 60, her dream was to continue walking, but now thanks to a new scoliosis procedure, she's back in the pool. And now she's joining us this morning along with neurosurgeon at UC San Diego, Dr. Joseph Osorio. Good morning to you both. Thank you so much for being here.
Good morning. Thank you for having us.
Yeah, of course. Well, Michele, I want to ask you a question. I know you were an athlete with Olympic dreams. You're doing great now, but can you tell us what you were dealing with before? Degenerative scoliosis, I know, caused you pain and even struggled for you to breathe.
Yes, I had great difficulty walking. There were days that I was in a wheelchair, days when I just used a cane, but it was debilitating. The pain was absolutely excruciating.
And doctor, I want to ask you how the artificial intelligence helping you in the operating room. And with Michele, I know you said you were dealing with some pain, but now with Michele's surgery, how is that new technology making a difference?
It's made a tremendous difference. We're literally leading the field in San Diego and worldwide with this patient-specific technology. As you know, all of our bodies have different shapes, different sizes. The shape of our spine, when a surgeon like myself does a surgery, we have to, for a scoliosis, place rods and screws and fix a person's spine in the correct alignment. I'm simply using the most modern computer technology, which we actually use in our daily lives all the time, whether it's a Google or Amazon request. You can see how that kind of computer technology can help. And so we're using that with prior patient data, about 8,000 scans, and that allows us to make a specific implant, a rod that's curved exactly to the patient's body. And that allows us to get excellent outcomes. And that's what we're seeing right now at UCSD.
Taking a look at those x-rays, it's absolutely remarkable to see that. Now, Michele, 4 months after your surgery, what's your life like? Are you back in the pool and swimming again?
I got back in almost exactly 4 months after my surgery. It was my first time in the pool, and I was very careful to stretch and just kind of feel my way. And it was like I had not stopped swimming. It just felt natural again. And I was just inundated with so many feelings about being able to do this after going 6.5 years without doing my sport.
Oh, that must have been such an incredible feeling for you, jumping into that pool. Now, Doctor, AI and predictive analytics, what are your hopes for the future? I know this is something that could help so many people like you, Michele.
I can imagine that as we look towards the future, when I did the implants, the rod, the patient-specific rod for Michele, it was just the rod. And when we do these procedures, sometimes we have to take out the disc, put in an implant into the disc space. I was able to use that technology together with the rod and placing robotic screws, all combined for patient-specific surgery just last month. So when Michele came 2 years ago to have her surgery, we were doing the rod first. And now this is moving forward to every single implant. So I'm excited in the future to see how all these technologies are really going to improve patients to have better outcomes for longer periods of time.
Oh, well, that's amazing. I know San Diego is such an advanced medical community, helping people like Michele and other athletes do what they love. So thank you so much for sharing your story this morning, and we'll keep up with that as well.